All right. Hey, welcome to our second 15-minute interview. We're just trying to get some information out to people. Today we have Erica here today, and she'll introduce herself here in a second. But I just wanted to let everybody know that on Wednesdays and Fridays at 6:30, we'll be releasing a video until we're done. It's been good for me already to have interviewed one person and learned so much, and I hope that everybody watching is getting the same types of things. We're going to move forward with Erica's interview, and so Erica, if you could do me a favor and just introduce yourself and tell us where you're at to start.
Hi, my name is Dr. Erica Essary, and I'm a licensed clinical psychologist and certified advanced alcohol and drug counselor located in the Chicagoland suburbs of Illinois. I'm also dual licensed in Iowa, and so my practice includes both in-person counseling and also online counseling.
Okay, so you're doing both. Amazing.
Mm-hmm.
Okay. So what is it exactly that you do?
So my specialties are substance use disorders, as you can see from my certification. And I also focus on depression, especially bipolar disorder. See a lot of that in my practice. I work primarily with, in my private practice, I work primarily with adults. I do have experience working with adolescents as well as an independent contractor on the side. And then I also focus on gender and sexually diverse people. The LGBTQ community is really important to me. Part of that is because I'm a member of that community, and I really want to make sure that they have accessible services.
Okay, so it's close to home. What's the most impactful point that you make to help others? So I know that, in my therapy and what I do, that a lot of times there's sometimes a theme or something that I know I use a lot that comes up. What's something that you feel like, or maybe more than one impactful point that you make to help others?
Of course, I think it's always really important that we talk about people's supports and people's support systems. And I often use this metaphor of a chair and demonstrate it with my hands. If a chair only has one leg, what's going to happen? It's going to fall over. Two legs, it's pretty rickety. Three legs, we're starting to get some stability. Four or more, which would be a weird looking chair, but you understand where I'm going with this metaphor. The more supports you have, the more stable you can become, and you can rely on one of the other legs of your supports if one isn't able to be with you or communicate with you at any given time. So really emphasizing that people need more than one person or sometimes even more than one community in their life that can help them out when they're in trouble.
Right. I definitely rather sit on a chair that has 32 legs on it versus just one leg, right? Like, I know I'm going to have some balance and be able to exist on that chair. Okay, very good. So recommended knowledge. So like you get your knowledge from somewhere probably, and there's some things that impact you heavily, whether it's a book or somebody you follow or any kind of podcast or documentary that you would recommend, or video, anything where we can steal some of the knowledge that you have.
Yes. So I'm a huge book reader, and my library's pretty big, and I try to stay up with the latest. I really enjoy reading autobiographies and people's personal experiences, as well as reading things from other people in our field, because I think both are important, but lived experience is really important, particularly when we're talking about, I think, both addiction and also gender and sexual identity. So I think that there's always great resources on the PFLAG website. I always recommend that people go there. I think it's helpful for especially for family members and loved ones to support members of the LGBTQIA community. And then regarding books, boy, there's been a lot of them. I really enjoy reading regarding bipolar disorder. I loved reading Kay Redfield Jamison's books. because she is not only someone in our field and is a mental health professional, but she also has lived with bipolar disorder and talks about what happened before she was diagnosed, and how she got through some really tough parts of her life.
Okay. All right. So just about anything that she writes, how many do you know about how many books she's written? Or
I think she's written 3 books. One of them is Touched by Fire. And she also talks about the creativity that a lot of people with bipolar disorder have, and how they often feel like they're accessing it through their episodes. So she talks about how there are many, many historical figures that likely had mental illness of some type of their own, maybe even bipolar disorder, and how they use some of that to be able to create some of the wonderful pieces of art in their lives.
right. Okay.
I did want to talk about, as far as resources, there are really great gender workbooks that I think are important, either for people that, I mean, particularly for people that are working out their own gender identity. But I think that it wouldn't hurt for people to also look through the health professionals to look through those books to know what's in them. So I would recommend for adults, You and Your Gender Identity by Dara Hoffman Fox, and My Gender Workbook by Kate Bornstein. Dara identifies as a non-binary mental health professional, and Kate Bornstein is a trans woman. And then there's one out for teens called the Gender Quest Workbook that's out there. And a lot of these, of course, you can get digital copies too. So if you don't want a physical book and just kind of want to look through some things on a tablet or computer, you can do that as well.
Okay. All right. Appreciate that. Super helpful resources. And that's something that we plan to be able to get from everybody is things that we know will help others and that have helped us to help others. Okay, perfect. So I have a question, just talking a little bit about bipolar, and this is, not something that we necessarily discussed before, but what would you say success looks like when we talk about bipolar? What does success look like in mental health?
Well, of course, we're going to say that each individual is going to have different goals with their treatment, and we're also looking at the difference in severity. I mean, someone who's diagnosed as a bipolar 1 could have a main goal of lowering hospitalizations because they have a lot of them. So it could just be, staying out of the hospital, stability for the first year, being medication compliant, again, building up those support systems, and maybe getting additional support, not just doing individual therapy, but maybe groups, whether they're therapy or just other support groups. I think that that's helpful. Bipolar 2 folks, I think, again, may not reach the level of hospitalization necessarily, but because they struggle predominantly with the depression part of bipolar disorder, I think, checking in with any suicidal ideation, and just knowing that episodes pass, knowing that they will come out of things, that they, that these moments do end, and that their moods and feelings are also transient. I know that it really is a struggle when they say, well, I've been in a depressive episode for months and months, but there are moments of respite, and trying to figure out how to do their best during those times, including sometimes seeing the signs that they're about to enter into an episode 2. I think identifying where they know that they're at, so that they can put some procedures in place to help get them through it, whether it's manic or hypomanic episode or depression, a lot of times people after a while can say, I can feel it coming on. And it's like, well, if you know that that's happening, what can we do to give you the best chance to get through this with, minimal turmoil?
Yeah. Okay. Yeah, that's a huge thing, I think, throughout, um, I guess in healing in general, is being able to recognize first what's going on, right? And then being able to follow what it is that we need to do to stay in the place that we want to be. So, okay. So this one, I'm going to combine two. So I want a story really, and or a challenge or homework that we can give our audience to have and take with them.
I think regarding the gender piece, I always want to ask people to try and be aware of how much they are gendering people, how often it's happening, and the assumptions that we make about other people's genders. Because the more sensitive and an acknowledgement we can give to it, the more attention we give to it, the more we can be sensitive to clients coming in where you don't know, they might be questioning their gender identity. That might not be what they came in for, but that those thoughts could be rolling around in their head. And if they go to someone who is open and and affirming, they might feel that they can bring that up in addition to whatever else they want to talk about.
Yeah.
So another challenge is, for example, looking at your paperwork as a mental health professional. Do you have an option for gender, for transgender or other, or a non-binary? Do you have a write-in option, maybe even for your paperwork, so people can definitely find the term that they identify with best? Do you have a space for preferred name or a nickname? A lot of places now, even in EHRs, because I have an electronic health record, there's a space that's called nickname, and I can put someone's name in there, and then I still have their legal name for insurance purposes on their paperwork. But when anything gets sent out from me, their name is what they see. They don't see their legal name if they're not going by it.
Yeah. Okay. Hey, and so that's on the clinician side of things. What about for the person who comes in and doesn't see what's necessary to get the help? Do you have any recommendations or any kind of help for them to be able to look past that and or get to the next step to being able to get the help that they need?
You mean for a potential client?
Yeah, for a potential client coming in maybe and who is dealing with something related to gender, and maybe they don't even identify it initially, but they don't get that response that they probably should or that would be helpful to them.
I think it's always important, as with any reason, you might find yourself seeking a therapist, to always do some homework on the therapist and ask them questions, look at what their background is. Do they talk about being affirming of gender and sexually diverse people? Ask them if they have worked with clients. And if they're looking for things on their own, plenty of useful websites and groups. I know a lot of people are in Facebook groups or on Reddit in certain subthreads, getting questions answered about gender. So many of my clients watch YouTube videos, of course, for free, and they can look at people's gender experiences and see that if they have some thoughts about, oh, I have to be this way or I have to be that way, that's not true, that you can figure out what your identity is, and your presentation could be different from your identity. And there's just a lot of freedom, a lot more freedom than I think some people realize. They don't have to feel stuck in some type of stereotype.
Yeah, I really like that idea. Yeah, the idea that there is not the lines necessarily that everybody else is creating that has to shape who we are, right? So, all right, I appreciate that. Is there anything else that you wanted to include in being able to share with others before we close?
Well, aside from, again, just people always, whether you're someone seeking therapy or whether you're a therapist looking for another therapist who has, a specialty, please reach out to us because I really love to answer questions. I love to help people. Whether or not someone even becomes a client, I really enjoy like helping them navigate insurance or getting to the right professional. For instance, sometimes people call me and say, do you prescribe medication? Or I'm looking for medication. And I said, I know that you're looking for that. You want a psychiatrist.
Mm-hmm.
And while I can't provide that for you, tell me where you are and let me see if I can connect you with someone in the area. So if you can, if you either want to ask those questions, please do. We want to answer. Or if you're on the clinician side, if you can develop a network of people you can trust that provide services that you don't, such as medication management. I think that that's really key because clients are going to ask you those questions. They're going to want to know where else to go to get all of their needs met.
Absolutely. Okay, I appreciate that. So I want to close by saying I really appreciate your time. Thank you for taking time out of your day to come share with us and to kind of spread the knowledge around a little bit. So thank you so much. We'll be back with another 15-minute interview pretty soon here. So again, Wednesdays and Fridays at 6:30, we'll be releasing these until we're done. Thank you all for your time and have a good day.
Okay.